Recording in progress.
Okay, Henry, we're gonna get started now. So I'm gonna have Myra gonna come up and then do the intro.
Welcome, everyone. Thank you for attending today's webinar with eLotus, your leading provider of TCM continuing education. My name is Myra Chen, and you are probably wondering, who is this new person? I am the niece of Dr. John and Tina Chen, and I have just enrolled in a TCM school this year. I hope to enrich myself with the knowledge and wisdom of our ancestors and also the great doctors of today, so I can carry on the torch and continue to spread the pearls of Chinese medicine worldwide. You are probably also wondering, where is Donna? Well, she is right there training me. Hi, Donna. Aside from my family, she is my biggest mentor, and I'm very fortunate and grateful to have her coaching me today and to be your MC and host for this event. This is my first time in doing this, so if I goof up, please excuse me. Today's webinar is Tung's Acupuncture Guide to Men's Health, presented by Dr. Henry McCann. I have heard loads of good things about him, and I'm looking forward to today's class. Before we begin, let's do a little housekeeping. Today's webinar will be from 9 a.m. to 6 p.m. Pacific time, and we will have 4 breaks with lunch from 1 to 2 p.m. If you have not already, please get your copy of the lecture notes from the blue course access page in your account. If you would like to join the chat, please do the following right now. Set your chat preference to everyone so that everyone can see what you're typing. You'll have to do this manually because the default setting allows only the speaker and staff to see what you're writing. If you have any questions during the presentation, please type them into the question box in your Zoom control panel. The quiz and the video replay will both be available tomorrow, and you'll receive an email notification when they are ready. Our speaker today is Dr. Henry McCann, who is joining us from New Jersey. Dr. McCann has taught several Master Tung classes with us on the eLotus platform. So if you have enjoyed today's class and want to further your learning, please take a look at his other courses available at elotus.org. Donna will provide the link in the chat room for you. Dr. McCann has also written Master Tung books. He is a co-author of Practical Atlas of Tung's Acupuncture and author of Pricking the Vessels, Bloodletting Therapy in Chinese Medicine. And to add one more thing to his resume, he is a faculty member at the Pacific College of Health and Science in New York, where he teaches medical classics as well as other doctoral degree programs in the US. Now let's begin today's class and welcome Dr. McCann. Okay, Dr. McCann, please take over now and share your PowerPoint.
Hi, Henry. Your mic is mute.
There we go. Thank
Got
you. Let's start again. So anyway, thank you everyone. Thank you everyone for joining today. It's really a pleasure to be back with eLotus and all of you in the crowd. Skimming through the attendees list, I definitely see some names that I recognize. And I'll certainly I see some names not only that I recognize but that I know I've interacted with in person in the past, but then also a lot of new names as well, which is always really nice. I think these kinds of platforms are excellent to really spread material far and wide, which has always been my goal. I think the more people who do this kind of so the reason that I teach this material is because this is the material that I use every day in my clinic, all right? And I want to make sure that that's clear right up front. The reason that I feel it's important to teach the material is because I find it very, very useful. And so I've been around for a long time now practicing Chinese medicine, and I've had experience with many systems of acupuncture. And I will also say that I don't necessarily think that there's one system of acupuncture that is superior to any other. You can do any system of acupuncture either really well or particularly poorly. Some of the best acupuncturists I've met are TCM stylists. I have great respect for so many of my teachers who are Japanese acupuncturists, and they were all fantastic practitioners. So in the end, it's up to each of us to really sort of find an approach that suits our own personalities, suits our abilities to sort of apply it in the clinic. But it's also up to us to really sort of delve into our approach as deeply as we possibly can, and that's really what's the most important thing. So as we go, so just a couple of prefaces before I pull up the PowerPoint, we get into the material. First thing I want to just let everyone know, of course, is that when I'm trying to teach the material, and I'll try to model this as best as I possibly can, the most important thing is that we try to understand what we're using and how we're applying it. So when we go through the pitfall of these kinds of classes where we do something on men's health or on endocrinology, or we've done other topics in the past on pain management, it's very, very easy for us to say, oh, okay, erectile dysfunction, use this point, right? Or problems with urinating, use this point. And it's never the case in Chinese medicine that one point treats one specific condition, right? So the reason we study these Chinese medicine through the lens of certain types of disease diagnoses is to give us an idea of how to try to understand the inner principle of what we're doing with needles, right? So the points that I'm going to talk about are commonly used points. I can't say that they're not commonly used points when we get to the disease section, but they are really just examples of how can we try to understand a certain condition through the lens of Chinese medicine, and then use acupuncture to sort of bring back a better state of health balance, however we want to describe it. But that means that the points I'm giving you are examples of ones that are possible. They're not necessarily the only points, and they may not be the best points for your specific patient. What's important to remember is that I'm trying to model a way of thinking about acupuncture that then will sort of set you free from protocols, right? Because it's not about protocols, even though when we teach, we have to give protocols, but the more important thing is understand the underlying mechanism behind those protocols, right? And I'm going to try to model that as best I can. You know, we have a short period of time, so we'll do the best we can here. I'll also say that ideally, this is a sort of an intermediate level class. If this is your first time doing Dong's acupuncture, it may be a bit overwhelming because I'm not going to go back through all the basics in fine detail. We'll do a quick review at some point, and again, I'll try to model those basics because there's really nothing beyond the basics. The basics are, you know, everything. You know, I can see my friend Robert is on today, and he says the basics are already advanced, and I couldn't have put it better. That's really I'm stealing that phrase from him, but I'll attribute it each time. So, you know, the basics are where we have to really sort of focus ourselves. And again, I'll try to model that as we go through. Of course, if you find that the material is going by a little too fast, then I would suggest you go back and find either a book on Dong's acupuncture. I have a book out. My friend Robert, Dr. Chu here, has a number of books out. Dr. Yang Weijie has some excellent books. Dr. Wang in the Chicago area has an excellent book. Any of these are great starting points to really go and read about some of the basic concepts. And eLotus has a wonderful set of classes that really go back at a more basic level and go over the material. So if it feels like it's going a little too fast, then please do your due diligence and go back and really study some of the basic courses first, and then rewatch this one again. Okay, that's my disclaimer. It's my beginning intro. Donna is with us also, and Donna, if you can start looking at collating questions. I will try to keep an eye on the chat, but sometimes in the middle of things, I don't always see a question that may come through. So Donna can start looking at questions, maybe look at some of them. If there are some that overlap, we can bring some of them together, and then we'll answer them right before we take some breaks. Okay, so let's go into the material. Today, we're going to be talking about men's health. To start off with, I'll give just a little bit of a definition and the background of men's health. Then we'll look at some basic concepts, some basic points, and then we'll go into some sort of disease presentations just to give us an idea of how to sort of conceptualize this thing as a group of ideas and techniques. Okay, let me bring up the presentation. All right. So what we're going to be talking about is something that in Chinese is called nan-ke. The word nan means male or men. Ke is a specialty, right, or a specific discipline. When we're looking at nan-ke as and I'm translating this as men's health, we can do men's specialty, men's medicine, all these things are possible ways to sort of render this, this term. When we're talking about nan-ke, there are a few different things that fall in this category. And the four main areas that we can identify are sexual dysfunction, which is we'll spend quite a bit of time on. And when I talk about sexual dysfunction, we can talk about conditions such as erectile dysfunction, premature ejaculation. In the Chinese literature, we see this term called yijing. Yijing is loss of jing. Sometimes it's translated as nocturnal emission. Sometimes it's translated as spermatorrhea. I'm going to go a little bit more in depth shortly about what this thing is that we call yijing from both a historical and modern perspective. And I'm going to argue, hopefully, that we basically redo all our textbooks and get rid of the term spermatorrhea because it's really weird. And we'll talk about historically where that term comes from and what it really might be and might not be. We'll come back to that. So those are all things that would fall under the category of sexual dysfunction. Infertility is pretty straightforward. We're not going to spend a whole lot of time in infertility because mainly the patterns are going to be the same, the things we're going to be seeing. And you'll see me eventually near the end of the day start sounding almost like a broken record. Because if we get the basic idea, then a lot of points, because acupuncture can be very, acupuncture is both specific and very, very wide ranging in terms of its regulatory effect on the body. So we're going to start seeing a lot of concepts that are similar across the board for a few different categories, for example, both sexual dysfunction and infertility. Why? Because only a certain number of channels can eventually be involved, only a certain number of organs and patterns are potentially involved. And once we get a handle on that, then we can see how we can treat it very flexibly. Okay? And that in the end is the idea, is to try to treat things flexibly. Prostate disorders are the third main area that we'll talk quite a bit about. And then the last is sexually transmitted infections, STIs or STDs, depending on your preference of terms. We'll touch on this briefly. We're not going to touch on it quite too much, mainly because the other things, in my opinion, at least in my clinic, in my experience, the other areas are the ones we're going to be seeing a lot more often, right? If someone has an acute chlamydia infection, please do not treat them. Please send them to their regular doctor, right? There are certain things that ethically we should be treating and certain things that ethically, in today's day and age, we probably should not be treating. And so that's something that we'll talk very briefly about, but we won't go into quite as much detail for that. So those are the four main areas we see under the heading of non-cut, which is men's medicine, men's health, men's specialty, however we want to sort of translate it. Now, interestingly, non-cut is a relatively recent innovation as a specialty within Chinese medicine. So Chinese medicine, without a doubt, historically has developed specialties and had specialties within its ranks for quite a long time. The very first non-cut clinic was established in Hunan province in 1983. So it's a relatively new, not that these disorders were not treated. I don't want to say that. These disorders were always treated in the past, but we didn't necessarily have specialty, monographs, textbooks, hospital departments, clinics that are devoted solely to this topic until relatively recently. To the contrary, specialties such as Fuke, which is gynecology obstetrics, is a much older specialty. It dates from the Song and Ming period. So the Song dynasty is 960 to 1279. Ming dynasty is after that, basically 1300s to the 1600s, 1644 is when the Ming dynasty ends. So really, for a lot longer, we've had this Fuke, this gynecology obstetrics as a specialty. I will just point out that this is not necessarily for egalitarian reasons. Most of the reasons that we see historically for the development of women's health really are still male-centered. Why? Because there was a significant concern with the female gestational body. In other words, the female gestational body is that which allows for the continuation of family lines through female reproductive function, right? So of course, keeping women healthy for the purpose of establishing family lines was an important societal concern, right? And that's in many ways the main impetus for the initial development of Fuke as a specialty. So I don't want to say that I don't want us to say that to think that everything was very sort of egalitarian, men and women with doctors, and that's why we had Fuke even before non-cut. So that's just a little bit of that that background. Now, getting back to non-cut. So why did non-cut develop? And we'll talk about these terms in just a second. Why did non-cut develop? So the non-cut as a specialty developed as a complex reaction to quite a few different various social and political changes and norms that are happening through the end of the 20th century. And if you want to read more about the sort of background in a more detailed way, then we can go over, because our focus is more clinical, although I think the understanding the history helps sort of orient us to why we're doing certain things or why certain things are in focus or out of focus in terms of even disease states. Because even the way we diagnose disease is always based on politics and culture, right? Nothing escapes the idea of really politics and culture. So if you want a deeper dive into where this specialty comes from and the complex social changes that were happening around the development of this specialty, in the references I give you, it's one of the last references I can point it out at the end of the day. There's an excellent article on the sort of background of where this nanka comes from as a specialty. So what we see eventually, especially in going into the 1980s, and this is coming out of the Cultural Revolution, which happens mid-60s and mid-70s, we see a gradual change. We see a gradual change in focus of the collective, in other words, subjugation of self and self-desire for the desire of the state and desire of the country, where that eventually starts moving away in favor of the individual to some extent. So this is coming to this slide here. We have this term here, Yijing, which we commonly translate in modern TCM textbooks as spermatorrhea. Why? Because we see it in the Chinese literature. And then the move goes to the second word here, which is literally yang wilting, right? Yang wilting is the term that we usually translate as impotence or erectile dysfunction. So historically, prior to the 1980s, very few patients came to the clinic complaining of erectile dysfunction. There was a much more common complaint of this thing called spermatorrhea or yijing, which we can also discuss as sort of nocturnal emission. But the characteristic of yijing is the loss of semen without orgasm, right? So it's the loss of semen without sexual excitement or the sexual pleasure of orgasm leading to ejaculation, right? So it was loss of semen. The discussion of erectile dysfunction or the complaining of erectile dysfunction was seen by many in society and sometimes many physicians as something that was hedonistic and prioritizing of self-desire, right? So I'm going to the clinic because I can't feel the pleasure of orgasm, so I'm going to see a doctor for it. That was not necessarily something that was potentially socially acceptable. And sometimes doctors were warned about claiming that they could treat erectile dysfunction. So yijing was something that was without necessarily that prioritization of me as a sexual being desiring of pleasure, right? Get that idea? The term spermatorrhea, which is what we commonly translate it, goes back only to the 19th century or so in the Western literature. In the Chinese literature, the term yijing that we translate as spermatorrhea, we can go back, we can see in medical literature going back at least 1,600 years or so. The term spermatorrhea, to the contrary, is actually a relatively new one in Western literature, which is why I think it may be a fairly inaccurate translation of yijing. So at the very least, I'm going to encourage us, those of us who work and translate textbooks, to sort of try to get rid of this, this translation. Now, the Western definition of spermatorrhea was ejaculation outside of marital sex, right? And so that's something that we need to sort of understand, and that's where this diagnosis comes from. It comes from a very sort of sex-negative European culture, especially of the 19th century, where we're really thinking about sex within the bounds of marriage. So spermatorrhea was a way that men could go to physicians and complain of something related to ejaculation outside of marital sex. Unfortunately, in Western tradition, it was treated in a fairly excessive and perhaps draconian way. Forced chastity, avoidance of masturbation, circumcision, various different types of drugs, and even castration were typical Western treatments for spermatorrhea. Now, when we're looking at yijing, which is loss of semen, nocturnal emission from the Chinese perspective, usually and most commonly what we're talking about is either nocturnal emission, or it's a complaint related to sexual dysfunction that the patient is simply too embarrassed to talk about in a way that seems to be centering self-pleasure. In other words, rather than talking about erectile dysfunction, we can talk about spermatorrhea. Or rather than talking about premature ejaculation, we can talk about spermatorrhea. Eventually, what we see is a transition in the 1980s. And part of this happened, I do believe, historically, because of the one-child policy, because there's a change in the meaning of sex and reproduction. In the early Maoist era, the idea was we needed to produce enough people in China so that we could create a strong nation. Once we have the realization we're creating too many people, in the 1980s, we have the one-child policy. To some extent, culturally, it changes the meaning of sex within modern Chinese culture. And starting around that time, there was also a change in cultural acceptance of men's prioritizing of their own sexual desire, potency, etc. In which case, we see this gradual transition from patients complaining of spermatorrhea to patients coming in and honestly complaining of things like especially erectile dysfunction, impotence, or things like premature ejaculation. And so, interestingly, if you look at the data that we have coming out of China today, the number of clinics that actually have patients complaining of this I Ching has shrunk to minimal, if any, patients. Instead, patients are coming in and complaining more of this yang wilting, which is erectile dysfunction. So we see eventually the transition from something that's moralistic and nationalistic to something that's naturalistic. Interestingly, in Western medical history, we see the opposite. If we go back to ancient Greek medicine, we see a very sort of naturalist approach to how do we deal with male sexual function. And then we see in a Christianized Europe from the medieval period into the centuries after that, more of a change to a moralistic approach to how we handle healthcare, right? And today we see in the United States, for example, this tug and pull between naturalist healthcare versus moralist healthcare, even with the discussion today, for example, with abortion rights, right? So anyway, my goal for us all is when we are teaching our students of Chinese medicine, when we're looking at TCM textbooks that list spermatorrhea, realize it's simply not a thing. Most men do not walk around and simply leak semen, right? This is an outdated diagnosis, one that does not actually jive with naturalist clinical reality. And we need to refocus on what are we really talking about, right? Are we talking about erectile function? Are we talking about an ability or inability to orgasm? Are we talking about a problem with ejaculation? Because we can have ejaculation that empties into the bladder instead of going outwards of the body. We need to be more specific about what we're talking about so that we can have a better idea of how to treat our patients. Okay, so let's go on to more specific material. First, let's just take a look at some of the Chinese terms. For some of you who don't speak any Chinese, this may not be of interest, although I think this is kind of useful just to help for those of you who do have access to Chinese literature, just look at the terms that are potentially used. So these are various terms related to male anatomy, reproductive anatomy in particular. First, for scrotum, the first term we see here is nang. Nang really means anything that is shaped like a bag or a sac, right? So for example, in Chinese, the gallbladder, because it's also a sac-shaped organ, is called the dan nang. Dan means basically gallbladder, but in modern Chinese, dan nang. So that is a sac of some sort. Yin nang means the yin sac, right? So even though we have this idea of yin and yang, men are considered potentially more yang. The area, because it is this area that's usually covered, hidden, that's an intimate area, we call yin because yin is that which is hidden, right? We can also call the scrotum the shen nang. Shen means kidney. In Chinese, sometimes the testicles are also called the Wai Shen, the external kidneys, which highlights the relationship between the external reproductive organs in men, in particular the testes and the kidney, as a sort of a functional unit to some extent. The other word we see here is luan. Oh, sorry, down to testes. So with shen nang is the kidney sac, because this is the sac. This is the bag that holds the Wai Shen, the external kidneys. Under the testes, we can have the word shenzi, which means kidneys, right? Or we can have, as I just mentioned, the word Wai Shen, the external kidneys. Luanzi is another term that we use fairly colloquially for testes. Penis, We have the word jing, which means a stalk of some sort. Injing is a yin stalk. We'll skip one, go down to yujing is the jade stalk. The zongjin is the ancestral sinew, right? So the sinew tendon, we especially see in the Neijing, in the inner classic, the word zongjing very commonly, which highlights, of course, the interrelationship between the penis and erectile function and liver function and liver channel function, right? So not only will we see kidney involvement quite frequently, but we'll also see liver involvement. Remember, the liver channel encircles the external genitals. So liver will become a very important channel that we'll see being used over and over again. Or, especially because we're talking about Tung's acupuncture today, we're going to see points that have an interrelationship somehow through a channel connection to the liver channel. So keep that in the back of your head. So we want to think of what channels are we starting to think of, which might get us into the area of the genitals, the reproductive organs in general. And then not only do we treat those channels directly, but we know that in Tung's acupuncture, or you will know now if you're relatively new, and if you're relatively new, hold on to your seat. You will know that, of course, we're choosing channels that have an interrelationship with those channels, right? So that's something to keep in mind. The vas deferens and seminal vesicles are called the Jing Dao. The word Dao means the pathway. Jing as in Jing, Qi, and Shen. So it's the essence pathway, which is, I think, fairly self-explanatory. The prostate in the pre-modern terms, frequently it's called the Jing Shi, which means the abode or the chamber of the essence. Again, we have the word Jing, which again highlights the close relationship between reproductive function, between everything we're going to be talking about in kidneys. We're going to see kidneys so this is a main theme for all of today, is going to be kidney, 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 and more kidney. The more modern term we see for prostate in the Chinese medical literature is the qianlixian. The word qian here, the third character, simply means a gland, right? So this is really the more modern medical term for prostate gland. One of the books we're going to be talking about throughout today is a book called the Ishinpo. The Ishinpo is a Japanese text, and we'll talk more about the Ishinpo a little bit later and where that comes from. It's a fairly important text that preserves some early Chinese medical literature, which is of really significant interest in the discussion of sexual yoga, as a lack of a better way of putting it. We'll see some herbal formulas from the Ishinpo a little later today. These are some other terms we see from that text. We see the yu, which means the jade object, which is another term for the penis. This one I particularly like. This is a term that I had not seen before looking at some of the Ishinpo. It's Yangfeng, which means the yang or the male vanguard. Excellent. That's penis as well. We can also see this term here, nu, which means angry, or qi, which means to rise or to arise. That's in a term for an erect penis. Note also here, in terms of five-phase theory, the word nu, anger, angry, that is a term in five phase. So that's the emotion, that's the affect, mind affect, that goes with wood phase, right? And wood goes with liver. So we see this connection even in these kinds of terms with the normal functioning of the penis and the normal erectile function of the penis, right? And so we'll see, again, lots and lots of liver connections. Keep that in the back of your head when we're treating this specific area of the body, which means not only are we using liver channel, but since we're doing Tung's acupuncture, we're using channels that connect into that channel as well. And maybe my favorite of all of these is, which means death, and that's the non-erect penis. So hopefully we're going to bring our patients from the dead to the angry, and that's going to be one of our goals of treatment as we go through today. Okay. So let's take a look at some early references in relation to sexual function and reproductive function in men. So this will start with, of course, where we always have to start, which is the Neijing. I think if you teach a class in Chinese medicine and you don't bring in the Neijing police will come and club you over the back of the head and say, you got to bring in these texts. But I think we do this to understand that these ideas have been around for a long time and they still can help guide clinical practice today. You know, I like study, many of you know, one of the other classes, another little For those of you who are not familiar with the range of classes that I've taught before, we did a great class not too long ago, it must have been last year, on looking at treatment strategies from the Neijing and the Nanjing, how they're expressed through Dong's acupuncture. That's an excellent class. It was one of my favorite classes to prepare. Hopefully I did a good job for people. So take a look at that if you're interested in it. And I like to tell people the reason that I think it's important to go back to these texts is not because I think old is always better, not because, you know, it's kind of quaint and interesting, but because it's still very clinically relevant, right? It lays down some core principles that really are still relevant with our patients today. So this, of course, comes from the Shanggu Tianzhen, which is the first chapter of the Suwen. The name of the chapter is The Truth of Heaven Passed Down. The treatise on the truth of heaven is passed down from high antiquity. You know it's got to be good. And this is the very famous, one of the famous sections on the proverbial cycles of 7 and 8 in terms of the aging process for men and women. And so we will focus on the male section. If you want to read the women's section, you can go read the women's section on your own. So here we have in a male at the age of 8, the chi of the kidney is replete, his hair grows, and the initial teeth are substituted. In other words, the baby teeth fall out, we start having the normal teeth grow in. Notice as we read this passage, and it's the same when we read the female component, that the teeth are an interesting sort of sign of the growth process. Why? Because again, this is all going back to this systemic correspondence type of thinking. Teeth as bone are the most visible, because they're the most visible bone in most of us. It's the visible aspect of what we can see that related to kidney, right? Because teeth are bone, bone is the tissue outgrowth, that which is under the auspices of kidney. So at the age of 8, the chi of the kidney is finally online, right? So kidneys move slowly. They're related to growth, maturation, development. So that we don't have fully formed kidneys when children are born. Why? We see we don't have ossified bones. We have soft spots in the head. So it takes a while for the kidneys to really sort of come online, which is why formulas like Liu Wei Di Huang Wan are originally pediatric formulas, right? Because it has to do with the kidney growth happening or not happening at the right time. So that's the initial. The second at 2 times 8, which is 16, of course, the chi of the kidneys abound. The heavenly gui arrives. This word gui is related to the 10 heavenly stems, and it's one of the water stems. So it's another symbol of kidney. If you don't know what the 10 stems are, go look those up in a TCM textbook. But it's the last of the 10 heavenly stems, which means it's one of the kidney stems. So all this is kidney, kidney, kidney. So because of that, now that the kidney is really fully functional, the Tian Gui, the heavenly Gui, is related to reproductive function. So then it says the essence chi flows away, which means essentially we can actually have reproductive function. We can have functional ejaculation of semen. Then it says yin and yang are he, they're in a state of harmony, which then means that the person can copulate, right? They can have penetrative sex, which means, of course, at the end it says we can have children as a result. So we'll see, again, even from the early times, kidney is very associated with all of this reproductive function. At 3 times 8, the chi of the kidney has reached its normal level. The sinews and bones are firm and strong, hence the wisdom teeth emerge, right? So we know that the physical body, kidney, Jing essence, are the most physically oriented in terms of physical body and structure, bone structure of all of the 5 zang. The wisdom teeth being the final growth of teeth, the final growth of visible bone, is the outward symbol that kidneys are totally online. They're totally doing what they're supposed to do, and the body has reached basically physical maturity, right? 16, we're not completely physically mature. By the time we get into our 20s, we're physically mature. So here, of course, the male grows to their full size. Men grow to their full size. 4 times 8, the sinew and bones prosper in abundance. And notice, of course, they're all talking about sinews and bone. This is liver and kidney. And the other important thing to remember is that liver and kidney are in a mother-child relationship, right? So kidney water is the mother of liver wood. And we'll see that when we're looking at concepts of how are we choosing points, right? So we can't ever forget the 5-phase relationships either. 4 times 8, sinews and bones proper in abundance. Muscles and flesh are strong. 5 times 8, sorry guys, here's the beginning of the end. And I will tell you not to take this literally. The 7 and the 8 are numerological symbols, right? And we know this is true because there's another chapter in the Ling Shu that gives both men and women aging in cycles of 10. So you don't have to take this literally. This is a way of understanding the whole process of everything, that it doesn't always happen by the time we're 5 times 8, we're falling apart, right? That's pretty bleak, idea in my book. Considering I'm getting on the other half of that, you know, I'm on the back half of the 100 already, so I don't want to think too much about that decline process. But here it says the chi of the kidneys weaken, the hair falls, and the teeth wither. So now we have the weakening of kidney chi, and as the outer symbols of that, then we see there's a problem with teeth and hair, because hair is the outgrowth of blood, which is also related to kidney. With 6 times 8, the yang qi weakens and exhausted in the upper section. The face dries out, the hair on the head and the temples show streaks of white. So we start getting this stuff here and here and here. And with 7 times 8, the qi of the liver weakens. The sinews can no longer move. And when we're talking about the sinews can no longer move, this also is referring to erectile function, right? Which we see because we're talking about eventually the weakening of the ability for reproductive function. And so we'll see that, again, liver and kidney are common themes. Right, so the heavenly gui is exhausted, that's related to water again. The remaining essence is diminished, and the kidney zang is weak, and the physical body is completely exhausted. And then the last, of course, with 8 times 8, the teeth and the hair go. The kidneys rule the water. They receive the essence from the 5 zang and the 6 fu, and they store it. Hence, when there is abundance in the 5 depot and 5 zang organs, essence can flow away, which means that we can have reproductive function. At this age, now the 5 zang are all weak and the sinews and bones have become sluggish. The heavenly gui is used up entirely. That's the reproductive function. Hence, the hair on the head and on the temples turn white, and the body and limbs are heavy. A male of that age no longer walks upright and no longer has children. So the other thing to keep in mind is that this is a pattern of transformation of the body that, while sometimes can be related to age, is not always. We know that we have younger patients than 8 times 8 that manifest this already. And sometimes we have older patients that are beyond 8 times 8 that are still physically vigorous. So in the end, this is giving us an idea of what potentially can happen over time with the kidney vitality. And because kidney is mother of liver, kidney and liver coming online and eventually declining with age. Okay. So again, of course, we see this focus on the liver and the kidney. We have this saying in Chinese that says gan shen tong yuan, which means the liver and the kidneys are of the same origin. They're both related to blood. They both have a connection to, because of the mother-child relationship, to Jing essence. Blood is related to Jing essence. And so when we're treating these, we're going to see that we're treating them fairly commonly, both of them together. Okay, let's look at some other early references. This comes from Ling Shu chapter 65. The name of the chapter is the 5 tones and the 5 colors. So Chibo replies, for eunuchs, remember eunuchs are castrated males. Their ancestral sinew, in other words, the genitals are removed. The chongmai is damaged and the blood cannot recover. Knots form in the skin. We don't have to go in too much depth in this quote. Just know that some scholars throughout history thought that this forms in the skin is probably basically a typo, right? It's a mistake or a brush stroke, because they're writing this by hand initially. Commentary by a physician by the name of Sun Ding Yi says that this should be, it's knots in the qi, not necessarily in the skin. Then it goes on to say the lips and the mouth are not nourished, hence they cannot grow a beard, right? So we can see that there is this tying in of the genitals, the development of the genitals to the development of secondary sexual characteristics. In other words, the growth of facial hair. And we see this as being sort of exemplified by eunuchs because they don't basically have that ancestral sinew anymore. So we can see, even though they don't understand what hormones potentially are, early on, if young men, young boys don't have that stimulation, in this case of hormones from the testes, then they don't develop those secondary sexual characteristics as well. Okay. Then it goes on to say there are natural eunuchs who are never injured. In other words, there's still some men, even though they were not castrated. So there is a possibility that naturally men have this insufficiency of something related to kidney, right? And we'll see this sort of discussion in hypogonadism when we're looking at like low testosterone levels, not necessarily from young people, but as people age, sometimes testosterone levels start tanking faster than they should, right? But that's what this is sort of talking about as a clinical reality. So it says there are natural eunuchs who are never injured. They have not lost blood and still cannot grow a beard. Why is this? Chibo replied, they were naturally, in other words, literally they were from heaven. They were naturally insufficient. The Ren and the Chong were not vigorous. And we can see this word vigorous is sheng. And this word sheng is the opposite in Chinese of shuai, which means sort of depleted, right? So they were depleted to begin with. So their ancestral sinew is incomplete. They have qi, but not blood. Right? What is the blood symbolic of? Blood is symbolic of that which is more yin, kidney, right? So they don't have kidney, they don't have Jing essence. The liver, because the kidney is mother of liver, is also in a state of insufficiency. And thus the lips and mouth are not nourished, and they also cannot grow a beard. This is from the 75th chapter of the Ling Shu. It says here, the lumbar spine, these are the large joints of the human body. The lower extremities allow a human to walk swiftly, right? So we can see, now we're going to see lower body associated with kidney, erectile function, etc. The stalk and the pendant, again, the penis and the testicles, the genitals, their trigger is in the body. In other words, they are the mechanisms for reproduction. That's basically the interpretation of this line. This is where the yin and the essence manifest, right? And listen to the rest of this. This is absolutely fascinating. They are the path for body liquids. Thus, when eating and drinking are without regulation, when joy and anger are not timely, when the body liquids spill over inside, they descend and they stay in the testicles. The paths of water do not move, and the testicles grow larger daily. So here they're talking about some sort of dysfunction of the external genitals that are not necessarily that which are from natural endowment. In other words, that which are from kidney or liver. But now we're seeing an association with some sort of sexual dysfunction that is related to lifestyle, right? It's non-internal, non-external. It's the miscellaneous causes of disease, right? It says when eating and drinking are without regulation, when joy and anger are not timely, right? So we will see erectile dysfunction in particular being related to things like diabetes, hypertension, stress, mind affect problems, all of these other things. So it's not only just, oh, give someone kidney yang tonics, right? If you give every ED patient, erectile dysfunction patient, who comes into your clinic, kidney yang tonics, right? It's like closing your eyes and throwing a dart at a dartboard, which is why we still can't assume every patient is just kidney, or every problem with the penis is just liver, right? You throw the dart at the dartboard, eyes closed. Sometimes you'll get it, and sometimes the patient will improve. Sometimes they don't, because we're missing something. We still have to look at everything going on in the patient's lifestyle, their stress level, all of this needs to be resolved. So for example, we'll see things like diabetes and cardiovascular diseases are major causes of erectile dysfunction. So obviously in one day, we can't talk about all the ways we treat diabetes. We're going to do that in another class. For those of you who are here live, this is tomorrow, Sunday. But sometimes we have to look at what we're really seeing in the patient and determine what points or treatments or formulas may be appropriate, not based on what we think should be there, but what we are actually seeing, right? That's an important thing to notice. And I think this phrase or this this little passage brings to light, right? It's not just kidneys. Other things are potentially happening that can affect reproductive function. Okay. Let's go on to the next one. So let's talk a bit about channels in particular and what channels we would be looking at, because when we're looking at acupuncture, so acupuncture is not exactly the same as herbal medicine. I know some of you have heard me say this before. And if you're new to this, I'm saying it now so you can hear it and make sure you understand it. So when we're looking at acupuncture, we have to take a look at what channels may be involved in what we're treating, but also what organs are involved, right? Because the channels and the organs are one sort of functional whole, right? We can't only look at Zangfu organ patterns. We have to also look at what channels may be implicated in any given condition. Sometimes when we're looking at a patient, it's more important to look at how can we more globally regulate rather one of the Zang organs. Sometimes it's just a channel problem, and we can't treat everything just as a channel problem. Although on some level we can treat everything as a channel problem because the channels go to the organs. Nor can we treat everything as an organ problem without looking at what channels are potentially involved, right? So let's look at some of the channels that we're going to be seeing more commonly used on a very regular basis in regards to what we're talking about today. So first look at the large intestine channel. So the large intestine channel, remember, is full of both qi and blood. It's one of the yang ming channels. So therefore we can use it for supplementation or drainage of, for supplementation in general. So we'll see some points in the large intestine channel being good for just overall qi and blood. We can also use it for draining of replete pathogens. In modern TCM, just to put it a little in perspective, we're talking mostly about Dong's acupuncture, but just to remind us, it was still useful in modern TCM. In sort of conventional, I'll just use the word TCM to talk about conventional TCM as in mainland China style TCM acupuncture. We see this in modern texts related to chronic and acute prostatitis. We can see it related to problems related to erectile dysfunction, yang wilting, scrotal problems where we have damp heat pouring downwards, points like Hegu, large intestine 11, and Bulla de Bend, large intestine 11, sorry, Hegu, large intestine 4, and then Bulla de Bend, large intestine 11, frequently used. For those of you who have some familiarity with Dong's acupuncture, don't worry, we're going to go more into these points, but we see points, for example, on the index finger being commonly used for problems of the genital region. So we have all of the Jian points. We'll talk about the 11.01 through, I don't remember how, I think there are 5 of them, through 05. These are points, again, on the large intestine channel. Remember, of course, the large intestine channel as the yang ming, and we'll go over this again shortly, communicates with stomach yang ming and the liver jue yin. So there's that connection that brings us into the lower abdomen and the genital region in particular. Stomach channel, of course, both the internal and external pathway of the stomach goes to the lower abdomen, which is obviously an important area when we're talking about reproductive function. Remember, the stomach is associated with 3 of the 4 Cs that we see in Ling Shu chapter 33, the treatise on the Cs, the Hai Lun. The C of Qi has stomach 9 as one of the points. The C of water and grain is stomach 30, Qi Chong and San Li, stomach 36. And the C of blood has both the Jushu points, the upper and lower Jushu points, stomach 37, stomach 39. So we see stomach as kind of a big deal, right? So we can see, of course, that there is a close relationship of the stomach channel to all of the qi and blood movement and supply in the body, right? The stomach, again, is the yang ming. Stomach as the soil or the earth phase is the latter heaven support of qi and blood. So we're going to see stomach channel points that are important, right? And the concept, or things that connect to stomach channel. So whenever we're looking at these channels, we can treat them directly or we can treat them indirectly through channel connection. The stomach sinew binds right above the genitals before it spreads to the over abdomen. In modern TCM, we use these points on the stomach channel to treat, again, yang wilting, impotence, erectile dysfunction. We also see it used to treat pain and swelling in the testes, testicular pain, mounting qi. The Zhenjiu Dacheng, the great compendium of acupuncture lists, in particular stomach 36 for impotence, for penile pain, for testicular pain. So even though the stomach channel doesn't directly touch the genitals, because it governs the entire lower abdomen. Movement in that area of the lower abdomen will inadvertently and almost always affect everything in the lower abdomen. So stomach channel becomes quite important. Let's look at the spleen channel. Ling Shu chapter 10 says the spleen channel ascends the medial leg and enters the abdomen to join with the spleen in the stomach. So on its way up, it brings nourishment to the lower abdomen. So the spleen channel also goes into the lower abdomen. Ling Shu chapter 13, it says the spleen channel sinew binds at the knee, which is near spleen 9, and then again at the genitals. So of course, we use spleen 9 in Dong's acupuncture. Points near this yin mound spring, spleen 9, have a significant effect on the abdomen and the kidneys, right? And so we see this connection even in normal channel theory. Of course, further down on the spleen channel, on spleen 6, we know that the spleen channel, the 3 yin meeting, that's why the Chinese names are more important than the point numbers. So Sanin Jiao, the 3 yin meeting, spleen 6, is the meeting point of the liver, spleen, and kidney, the lesser yin, greater yin, and the reverting yin. So it's obviously going to be an important point. In TCM, we use spleen channel points to treat impotence, infertility, mounting, which is Shanqi is like hernia. In Dong's acupuncture, of course, we have the lower 3 emperors, which we'll talk about as a Dao-Ma combination, which is intimately tied in with all these things we're going to be treating. Okay, let's go on to small intestine. We see fewer direct connections between small intestine and the genital region. Of course, we know the small intestine is responsible for separating the clear from the turbid. And in modern TCM, we use the small intestine channel to treat urinary disturbance. We see in Dong's acupuncture, there are a set of points near small intestine 9 and 10 that we use to treat, if we wanted to sort of TCMize it, just to help us think about it, if you're new to the system, damp heat conditions. So it's indicated for things like urinary tract infections or sexually transmitted infections. Think about damp and heat presentations because we're using this to separate clear from turbid. And we'll talk about the image. So remember, the shoulder image goes down to the lower abdomen. So we know these points in the area of small intestine 9 and 10, if we're looking at how the body's imaged out, can get us into the genital region. And we'll review that again shortly. Small intestine channel also connects to the Taiyang bladder, which is a water channel, right? So we have small intestine goes to the water phase through the same name channel combination. So we'll see points on the side of the hand on the small intestine channel being in Dong's acupuncture, something that we use to treat the bladder channel and the kidney in general because of that channel connection to the water phase. The bladder channel itself, we know from Ling Shu 10, has a direct connection to the brain, to the dumai, and to the kidney zang itself, right? So we can go to small intestine, bladder connects directly to the kidney. Bladder is also associated with the qi movement, qi transformation, the qi hua. We see that described in Suan chapter 8. And so we'll see some bladder involvement as well. The kidney channel, of course, is going to be very important. The kidney connects directly to the kidney and to the dumai. So we see lots and lots of connections, as we've been talking about so far today, to male urological function, to reproductive function, somehow mediated through the kidney. Now, again, that does not mean that we necessarily have to treat the kidney channel directly. We'll see other channels that tie into kidney channel that we will sometimes use. For example, we'll see a set of points on the ring finger, which is the Sanjiao channel, because the Sanjiao is the lesser yang, the Xiao yang. It connects into the kidney, which is the lesser yin, the Xiao yin. And again, we'll review that shortly. But so we see the channel itself, but then we have to think, what are all the connections that get us into that channel at the same time? But again, we'll see kidney as an organ pattern commonly listed. So we'll see lots and lots of kidney herbs. Not the only possibility, but certainly a big possibility. The gallbladder, gallbladder, I think a lot of people may think, gallbladder, reproductive function, but yes, we will see it frequently. First of all, the gallbladder is in an interior-exterior relationship with the liver. So we have wood phase here. The gallbladder also links up with the daimai, which encircles the abdominal region. So we will see some gallbladder points used for opening the movement of qi and in particular fluid in the lower abdomen when we're treating conditions of swelling and accumulation, right? So think things like testicular swelling, right? We'll see some gallbladder channel points that we can potentially use for that because of that specific connection through gallbladder. For those of you who are interested in things like the 10 stems, I want you to think of, and we'll get to this later. If I forget to get to it, someone remind me, but we'll get to it again later. So for the 10 stem aficionados, think, what does a gallbladder connect to in 10 stem theory? Because that will also bring us back into this idea of swelling and accumulation. So all these connections are, I know it's a lot to ask, but in Tung's acupuncture, I'm asking you to remember all of how the channels interact with each other, where they go in the body, what organs they connect to, and what functions they're trying to express as an expression of 5 phases, connection between phases, et cetera, et cetera. All right, the liver, also the gallbladder channel does also encircle the genitals by itself, and it enters into the abdomen to go to the sacrum. And as it goes to the sacrum, it passes through the area of the lower abdomen, which is the area in men of the prostate. So again, we'll see some prostate swelling points being related to gallbladder channel. And in women, the uterus. We're not going to be talking about it today, but certainly similar points can be used to treat things like cystic ovaries, uterine myomas, et cetera, because it's some sort of swelling and accumulation, right? And we'll come back to that. The liver, the last thing we'll talk about for just channels as an overview is the liver. Obviously, we all know, I'm sure, that liver encircles the external genitals. It's associated in Chinese medicine with the sinews, right? So sinew is the tissue out of the 5 tissues that go with liver. Remember, of course, that penis and penile function is intimately related with this idea of sinew. In Chinese, the penis is called, one of the terms is the ancestral sinew that highlights the relationship. This will also, again, highlight the relationship in terms of channel connections between points on the index finger with penile function, right? Which we'll see as we go through commonly used points. Yang Ming, large intestine, connects to Jue Yin. The Yang brilliance connects with reverting Yin. That brings us into the realm of liver in particular. Okay. The liver channel by itself is traditionally classically indicated, especially for the treatment of mounting, of Shan. Shan disorder is, think of it as hernia, can be testicular pain or swelling, epididymitis, et cetera. So we'll see liver channel either directly by itself or through connections, again, being talked about over and over again. Okay. Everyone happy? Any very brief questions on that? Hopefully we're not going too quickly. If we're going too quickly, someone can complain to Donna. Donna will, or if we're not going fast enough, Donna will speed me up or slow me down. All right, let's go on. So while we're here, hold on, we have one short thing. All right, it's just a smile from Donna. Good. Okay. So while we're here, let's go back. Since I've been talking about it, let's go back and do a very quick review of some of these connections. How are we thinking about how the channels line up with one another? So the first of the connections is this same name channel connection. So remember, we can think about what's happening with each individual channel, but we also have to ask ourselves, how do we connect in with those channels? And that's how we understand why points are doing what they're doing, right? And I'm going to suggest not only is it for Tung's acupuncture, it's all acupuncture, right? Acupuncture is just acupuncture. It's how do we actually sort of look at all those connections. So one of the ways we can connect channels is this idea of same name channel. So, and the same name channel, we're looking at the 6-layer channel names. Okay, so we know that the Taiyang connects with the Taiyang, the greater yang with the greater yang, Xiaoyang with the Xiaoyang, Yang Ming with the Yang Ming, and then the yin layers are similar, right? So same name channels are one large channel family, which is why, for example, we can use points in the small intestine channel to treat the bladder channel, right? So even in TCM, we use small intestine 3 to treat the back, right? And I know, of course, someone in the room is always going to mention, let's go to the Dumai as well. The connection small intestine 3 with the Dumai is relatively modern in Chinese medicine history. We've been using small intestine 3 to treat the bladder channel for easily 1,000 years before small intestine 3 had any connection whatsoever to Dumai. So the reason we have these channels that can connect one another is sometimes because of these channel connections, right? In TCM, we can use Sanjiao to treat rib side pain of the gallbladder channel, right? We can use large intestine 4 to treat abdominal pain of the stomach channel, right? So these are things that we see frequently over and over and over again. For example, in Tung's acupuncture, we'll see points on the liver channel, like liver 2 and liver 3, treat problems of the myocardium, treat heart rate, treat chest pain, et cetera, et cetera. Okay, so all of that is something that ties in. That's one way. Now, notice, of course, here we're using yang channels to treat yang channels and yin channels to treat yin channels. So sometimes maybe we want to use a yang channel to treat a yin channel or yin to treat the yang. Yang treating yang and yin treating yin is not so sexy, not so exciting. And we know in the Suwen it says the superior acupuncturist treats right from left, left from right, leads yang from yin and yin from yang. One of the meanings of this is that we eventually need to learn how to use yang to treat yin and yin to treat yang, which brings us into the branching connection of the 5 zang. Sometimes it's called the branching connection of the zang fu, depends on the author you're looking at. Let's just get to the punchline because we have a lot to cover today. So this is derived, one of the early places we derive this from is the 6th chapter, the Suwen, where it gives us the basic function of these 3 layers. So the Taiyang and the Taiyin are both the opening. So you can think about what that means. For example, the Taiyang layer is the opening of the exterior. That's where we use herbs like Ma Huang to resolve the exterior. The Taiyin is the opening of the interior layer, which is again why Ma Huang, those of you who are the herbalists know, Ma Huang enters the lung and the bladder channels, right? Because the Taiyin and the Taiyang both are the opening out to the exterior. Okay? So they have similar functions. They have similar jobs. The Yang Ming and the Jui are the closing, the Xiaoyang and the Xiaoyin are the pivot, right? Which means, here's the punchline, that we can then use the Taiyang and the Taiyin to treat one another, the Xiaoyang and the Xiaoyin to treat one another, and the Yang Ming and the Jui to treat one another. So this is how we get, for example, the index finger to the liver channel, right? It's how we'll get the stomach channel in Tung's acupuncture treating heart stuff, right? And in conventional acupuncture, this exists both in conventional acupuncture as well as in regular acupuncture. One of my first aha moments, you know, I went to school before Dedman's book on points was written. I remember getting that early in my practice when it first came out. And you know, when I can't sleep at night, I like to read Dedman. And my favorite thing to do is read points and look at like, what are the weird indications? And I came across lung 5, and lung 5 says it treats low back pain, right? And this is not Tung's acupuncture, this is TCM. If you don't believe me, go open Dedman's and you'll see low back pain and knee pain, by the way, for lung 5. Why? Because acupuncture is just acupuncture. Nothing is brand new and no specific style owns any one approach, right? We just have to figure out how we can, with some sort of adroitness, utilize these theories. So why does lung 5 treat back pain? Why? Because lung Taiyin connects in with the bladder Taiyang, right? Through this mechanism. So basically lung 5, same as bladder 40, right? It's the bladder 40 of the upper arm, of the upper extremity. Get the idea? So we can use this as a way to understand how channels treat one another as well, which is why, again, we'll see ring finger points to treat kidney, because it's the Xiaoyang and the Xiaoyin connection. Okay. This is, again, your very quick review of some of these concepts. So we can also look at the channel clock. Many of you are familiar with these ideas already because they're the basis of balance method acupuncture. It's taken all from the same material. So this, we will see that opposite pairs along the clock are also connected channel-wise. Some of these are the same we've seen already. So we already saw, for example, stomach and pericardium. And when I say clock, this is the timing of the channels. So lung is 3 to 5 a.m., large intestine is 5 to 7, stomach 7 to 9 a.m., spleen 9 to 11 a.m., etc. Every 2 hours. These are the 12 watches, the 2 hours around the clock. So we can see things we've already seen. So lung and bladder are opposite, so they're paired, but they're also Taiyin Taiyang. Stomach and pericardium, opposite paired, but also Jui and Yang Ming. Heart and gallbladder, also paired from the time, but also Xiaoyang and Xiaoyin. Now we have some new pairings. We have, for example, large intestine and kidney. And we'll see points, for example, like lingu, that do things like regulate urination, right? Because they regulate kidney. They can treat low back pain of the spine. Why of the spine? Because the kidney channel goes to the lumbar spine. That's another example. Spleen and sanjiao, we'll see that relationship, which is new. And then the last one that's new is small intestine and liver, right? So we'll see some of these as well when we're investigating points. Remember that we can also look at how channels or how parts of the body interact with one another. And this is, again, a very quick review. For a more in-depth discussion, there are lots of other classes that I've taught, that other people here on eLotus have taught. Dr. Chu has taught, Dr. Wang, one of my favorite Dong speakers, has taught, that go into these ideas as well. So here we can see the shoulder and hip go together, elbow and knee go together, hand and foot go together. We can invert the orientation as well. This orientation is more commonly used for pain condition. Why? Because how do you regulate urinary function from arm to leg or leg to arm? We don't so much. So we can see this next projection, which is more important when we're talking about internal medicine, right? So now we can see the hand and the head, the hand and the head go together, the foot and the head go together. We can see the inverse orientation, the hand and the foot go to the genital area. So we're going to see points on the finger go to the genital area. So here's what we do. We combine the things we've just talked about together. So let's say we need to treat a problem of the external genitals, like penile pain or testicular swelling. How do we do this? We can look at liver channel goes to the external genitals. So we can either treat liver channel directly, which is also fine, or we can treat it indirectly through a pairing. So if we want to get to liver channel, one of the options, of course, is going back. We can go from the large intestine. Why? Because Yangming and Jueyin are paired together, right? And then we know that the fingers go down to the genital area, right? The fingers are sort of like dangling down, like genitals dangle down. Sorry for that image. So we can choose points on the large intestine channel, which means on the first finger. Finger goes to genital region, large intestine goes to liver, also genital region, and you can't fail because we have a direct stimulation in that local area, right? So I've said this before, a definition of a distant point, because we're talking now about distant point needling, is a local point needled somewhere else. In other words, what point can we choose that has a specific resonance with the area that we're trying to stimulate, right? And that's what it's really about. How are we establishing a movement of qi and blood in one part of the body that will be resonated in a different part of the body, right? So combination of channel with image gets us to the genital region. This is very sort of basic Dong thinking. And so when we're looking at the points, the protocols are not just protocols. The protocols are how we understand this kind of thinking and this kind of idea. Everyone get that? So this is one of the other projections. This also helps us explain why this set of points here on the small intestine channel can treat things like urinary problems, right? So we have these points that we'll see a little bit later that are used for things like infection. It's indicated for sexually transmitted infections. Again, if you have someone that has what looks like a sexually transmitted infection, send them to their doctor, get them on whatever treatment, and then you can treat them afterwards. It's fine. Shoulder goes to the lower abdomen. That's one piece. Small intestine channel. Hold on. Small intestine channel connects in with liver, which means we get to the external genitals. So if we have damp heat condition of the genitals, small intestine channel, that'll do it. Why? Because small intestine goes to liver. These points on the shoulder can go down to the lower abdomen, the genital region, and small intestine separates clear from turbid. Voila, we have all of it. Get the idea? So I also points like liver gate in Dong's acupuncture can treat damp heat conditions of the liver, right? You think about it yourself. This area can get us to the liver. small intestine, goes to the liver. Small intestine also transforms clear from turbid, or separates clear from turbid, which is why in classical TCM, we also do small intestine points to treat things like jaundice, right? Nothing is new, nothing is completely unique. It's just how we're utilizing the concepts. Okay, so that's that. Quick review with that. We can also look at different projections. So remember, one of the other very important ones that we see in Tung's acupuncture is this projection of the small taiji. So all of the long bones, and when I say long bones, I mean short long bones as well, like phalanges. Tubular bones are all microsystems, right? So we can see, for example, points like the lower three emperors, which are distributed along the spleen channel, basically up and down from roughly spleen 9 to roughly spleen 6, however you want to define it. That's upper jiao, middle jiao, lower jiao, right? We're going to see points in the face shortly, right? The whole face is upper jiao, middle jiao, lower jiao. And so this is another way that we can tie into how are we actually getting stimulus of a point to a target tissue on the body, right? And then there's all the channel and other associations we can bring into things as well. Okay, so this is another thing that we will definitely take into consideration. Okay, let's just take a little breather for a second. Any questions on that material? So that is a very, very, very quick overview of men's health, where it comes from, some of the early literature that helps us get an idea of what we're going to be seeing, some of the channels that we're going to be looking at and seeing over and over again in some sort of relationship. A very, very brief review for some basic concepts in Tung's acupuncture of how we're looking at all of the connections, because it's all, listen, it's all about relationships. It's all about connections. None of us gets through life alone. There's no such thing as an acupuncture point. So stomach 36 does not supplement qi and blood because it's special, because it's just, this magic point on the body. Stomach 36 supplements qi and blood. And we'll talk about this tomorrow during the endocrine lecture. We'll talk about how can we understand more of a TCM function of a point, which I have a particularly, I have a complex relationship with, let's say, with TCM functions of points, just how I think of it in my head. But points don't have TCM functions outside of understanding channel dynamics, tissue, what their underlying tissue is, where in the body it's located. So when stomach 36 supplements the qi and blood, it does so because it's on a channel in a certain part of the body with a certain underlying anatomy, right? So the reason we have to understand all those connections is so we can understand why points are doing what they're doing, what part of the body they're targeting, and what types of presentations they're treating, right? There's no such thing as a point just does this because it does this. Anyone tells you it's empirical, it means they don't know the answer, or they're too embarrassed to say, I don't know why the point does it. There are lots of points to do certain things. Maybe I don't understand exactly why, but I know there's a reason why, if we think about it hard enough, okay? We'll do more of a deep dive in understanding TCM functions of points through the lens of why they're doing it, through channel concepts, tissue concepts, and zone concepts in the endocrine lecture. So that's for those of you in the future watching this on recording, that's a different recording. And for those of you today, that'll be tomorrow. Any questions before we take a little break? All right. Let's take a little break here. I know sitting can be a drag. We have 2 breaks. Donna, do you want to take 10 or 15 minutes? I can do either. 10 minutes it is. So Donna can put in the return time and Pacific time. I have a hard time doing time transfers in my head. Think about questions. You can put them in the box. You can, Donna can start collating. We'll be back at 10:26 a.m. Pacific time. Get up, move around, and have a little tea or whatever you like, and we'll be back soon.
Recording stopped.